my study is basically about postborn contractures after they have been released and skin grafting has been done. Postborn contractures cause disability in patients and it impacts the quality of life. Skin grafting is a very common method that is applied surgically after release of the grafts. So we applied two questionnaires. One is a WHO QL brief, which is the World Health Organization quality of life brief version. The actual version has 100 questions. This brief version has around 26 questions. This is a QOL score that we have used, and another thing we have used is a PROMs 29. This is a patient-related outcome measures instrument having 29 items. This has been developed by the NIH in the USA. This study tracks outcomes of patients that were enrolled between August 23 and March 25 on 57 patients. We have done a prospective observational study in a tertiary medical college. Total 57 patients were enrolled for this study. The time points for my results have been described as T1, which is pre-op, T2, which is 7 days post-operative, and T3, which is 3 months post-operative. We did analysis using paired t-test, radar chart, heat map, Sankey diagrams. For the interpretation of the scores, we have used official versions of the WHO QOL brief and the PROMs 29. Both of these are Likert scales having 5 items in each domain, in each question, and the questions have been divided into multiple domains. So the Likert scales have been converted using the official interpretation scales into different subcategories. For the PROMs, some of the scores are increasing, some of the scores are decreasing. So interpretation has to be done based on the official conversion tables that has the test inbuilt in it. So a brief description between what is the difference between PROMs and QOL. QOL, it is a broader subjective assessment of the overall quality of life of the patient. Now we are moving forward from QOL towards patient-related outcome measure, which is basically a measurement tool that captures the patient-reported health outcomes, not just the overall quality of life, but specific to the health outcomes. So, coming to the results that we got, we see that the WHO QOL has 4 domains: physical, psychological, social, environmental, and in all the 4 domains, we can see that there has been improvement in patient's outcome. Similarly, in PROMs, there are 7 domains: physical function, anxiety, depression, fatigue, sleep disturbance, social role, pain interference, and pain intensity. All of these have improved post-surgery. If you look into the data more detailed fashion, we can see that WHO QOL says that in both pre-op to immediate post-op and pre-op to late post-op, as well as immediate post-op to late post-op, all the functions have improved. But PROMs, it has more subgroups that are specific to the patient's health. It shows that actually the improvement is more between pre-op and late post-op. They are saying that early post-op and late post-op may not have significant improvement in quality of in the patient-related outcome measures. Then here we can see the radar chart. The radar chart on the deep red indicates the late post-op. We can see that the physical, social, psychological, environmental all have improved after surgery. As per the PROMs, we can see again the deep red one is the late post-op. We can see physical function has improved, social role has improved, but fatigue has come down, anxiety has come down, the pain intensity has come down, pain interference has come down, and sleep disturbance has remained more or less the same. If you look into the heat map, we can find out that especially for the last 7 categories, we can see that social role has changed maximally in these patients. The least affected is probably the anxiety and depression component and fatigue components. Most beneficial aspects have been in the social role and the pain interference and pain intensity. This is a comparison between the late post-op and pre-op changes. So, PROMs physical functions, if you see into the Sankey charts, only 2 patients remained in the low category. In this chart, the left side represents the pre-op condition. So, some patients in the blue were low functioning. Only 2 of them remained low functioning even after the surgery. Most of them moved from low to moderate. Some of the moderate patients, even after the surgery, stayed within the moderate patient-related outcome measure zone only. Their scores improved, but their overall life remained in moderate category only. But many of them improved from moderate to high. Similarly, the high functioning, they all remained high functioning, though their scores, if you look into the individual domains, they have improved. So, coming to the discussion, statistically significant improvement is seen in both PROMs and WHO-QOL domains. Consistent positive shifts seen in pain, anxiety, and physical function as shown in PROMs. Greatest benefits in social and psychological domains as per the WHO-QOL results. PROM tools have been validated by others in studies in rehabilitation context. Only 2 studies have been done in Indian context. And visual analytics effectively illustrate the recovery pathway. So these give us a feedback that we might be doing a lot of procedures, but it really improves the patient's life.
Thank you.
These are the references. Thank you.